Today we celebrate National Rural Health Day here on the House floor, standing shoulder to shoulder with our colleagues in the Bipartisan Rural Health Caucus, and I'm very humbled and honored to be here with my friend and fellow co-chair, Representative Diana Harshbarger. A big mahalo, as we've just heard from members on both sides of the aisle who took to the floor tonight to raise up the needs, the challenges, the hopes, and the dreams for healthcare in rural America. Mr. Speaker, at this time, I'd like to yield to the gentlewoman from Tennessee such time as she may consume.
Mr. Speaker, I rise today to highlight National Rural Health Month and to honor the men and women who keep healthcare alive in America's small towns and rural communities. As co-chair of the Congressional Bipartisan Rural Health Caucus, I'm proud to join my colleagues in leading an effort to ensure the millions of Americans who live in rural areas, including the hardworking people of Tennessee's 1st District, receive the same quality of care as anyone else in the nation. In Northeast Tennessee, that rural health care is it's a lifeline to people, especially who live in remote areas and are limited or have no mode of transportation, and they depend on a nurse, say, to drive during the night and before dawn to check on a patient, or the pharmacist who knows every family by name and stretches every dollar to keep medicine affordable. It's the doctor who stays late to see one more patient because there's no one else to take the next shift. These are the people who form the backbone of our rural healthcare communities, and they deserve a system that works as hard for them as they do for us. But the truth is, rural healthcare has always faced an uphill battle. When a rural hospital shuts down, it doesn't just take away healthcare, it takes away jobs and stability and peace of mind. And it means longer drives for emergency care, fewer options for expectant mothers, and limited access for seniors and veterans who depend on those services the most. And the systems that's supposed to support them is too often buried in bureaucracy. Pharmacy benefit managers are manipulating drug prices, restricting choices, and squeezing out small-town pharmacies that are fighting just to survive. These PBMs see a patient, but they control what medicines people can get and at what cost. That's wrong. And I've been proud to lead bipartisan legislation to bring transparency, accountability, and fairness to that system, because patients and pharmacists alike deserve better. I've made it my mission to champion these policies that put people, not politics, first. And under President Trump's leadership, we signed the Working Families Tax Cuts into law this year. And this critical legislation included the single largest investment in rural health care in history. That's $50 billion for a rural health care transformation fund to reinvest federal savings directly into the communities that need it most, expanding telehealth and recruiting and retaining rural health care workers. We're committed to ensuring telehealth remains an option for those living in rural communities. Telehealth provides expanded access to specialists, closes the distance between patients and providers, and gives families faster, more reliable care. And I have legislation, the Rural Physician Workforce Production Act, that would help bring more doctors to rural communities by giving rural hospitals the resources they need to train and retrain more physicians. I fought to strengthen our nation's drug supply chain by supporting domestic pharmaceutical manufacturing, including facilities like U.S. Antibiotics in Bristol, Tennessee, where we're proving that these life-saving antibiotics can and should be made right here in the United States and not halfway around the world. Mr. Speaker, these aren't abstract policy debates. They're about real people in real places. They're about the mom who drives an hour to find a pediatric specialist. They're about the veteran who can't get his prescription filled because his local pharmacy closed. They're about the nurse who works back-to-back shifts because there aren't enough hands to go around. And those stories are what drive my work every single day. And that's why I've joined my co-chair, Representative Tokuda, in introducing a resolution to recognize November 20th, 2025 as National Rural Health Day. This resolution recognizes the challenges we face, but more importantly, it affirms our commitment to solving them. Thank you, Representative Tokuda, for your continued commitment on working together to address the pressing healthcare issues facing our rural communities. We must fight for a healthcare system that serves patients, not big insurance companies, that values rural providers, not red tape, and ensures no community, no matter how small or remote, is left behind. To our doctors and our nurses, pharmacists, first responders who keep rural America healthy, We want to thank you. Your work saves lives, your compassion gives hope, and your dedication holds our communities together. As long as I have the privilege to serve the people of Tennessee's 1st District and as co-chair of the Rural Health Caucus, I will continue that fight. And we are united in our shared mission to strengthen rural health care, protect patient access, and preserve the small-town values that make this nation strong. And with that, Mr. Speaker, I yield back.
Mr. Speaker, this Thursday, America will celebrate National Rural Health Day. As a representative of 60 primarily rural counties and the congressional district with the most critical access hospitals than any other district in the country, I understand full well the importance of adequate, quality health care for all communities. Earlier this year, I proudly supported the Working Families Tax Cut, which established the Rural Health Transformation Program. This legislation made the single largest investment into rural health care in nearly 2 decades and will be life-changing for the men and women who call rural communities like the ones I represent home. The $50 billion in Rural Health Transformation Program will better position rural health care facilities to embrace innovative technologies while improving the way health care is delivered, strengthening health outcomes, and ensuring the health of rural Americans reaches its full potential. The quality of care that Americans receive should not and cannot depend on their zip code. By investing in the Rural Health Transformation Program and putting safeguards around the Medicaid program to guarantee it serves the vulnerable patients it was intended to serve, this Republican majority has taken historic strides to strengthen rural health care. Rural communities are the backbone of America, and I'm proud that I have supported this legislation to ensure that they have access to the highest quality care. The National Rural Health Month, this National Rural Health Month, I recognize and thank the dedicated rural health care providers, hospitals, service providers, clinics, and community health centers that serve as pillars in providing health services and life-saving care to Kansans in rural America and work to ensure that they receive the care that they deserve. Keep up the hard work, and thank you again for all that you do for your neighbors in rural America. Happy National Rural Health Month. Thank you, Mr. Speaker, and I yield back.
Mr. Speaker, Thursday marks National Rural Health Care Day, or Rural Health Day. Nearly 60 million Americans live in rural areas, and too often they encounter limited access to primary care, specialists, and health services. These gaps are worsened by transportation barriers, doctor shortages, and hospital closures. These challenges don't just affect individuals, they affect entire families and communities. Before coming to Congress, I spent nearly 30 years in the nonprofit healthcare field, assisting those with life-changing diseases and disabilities. Most of my congressional district is rural, and many constituents must drive long distances to get the care that they need. Some do not have broadband access. Some have limited transportation options. Thankfully, telehealth has added tremendous reach and value to communities across the country. And that's why I reintroduced the bipartisan Helping Ensure Access to Local Telehealth Act, or the Health Act, which cuts red tape and allows community health centers and rural health clinics to provide telehealth services to their patients. Telehealth makes life simpler for rural and underserved communities, especially our seniors. Telehealth is an essential part of health care that expands access to care for all Americans, regardless of location. Thank you, Mr. Speaker, and I yield back the balance of my time.
Mr. Speaker, in small towns and communities across America, rural hospitals are critical lifelines. They provide emergency care, support seniors and veterans, deliver behavioral health services, assist mothers giving birth, supply pharmacy services, and serve as major local employers. Yet many rural hospitals are under serious strain. Nearly half are operating at negative margins. Since 2010, more than 150 rural hospitals have cut inpatient services or closed their doors permanently, including some in northern Michigan and the Upper Peninsula. These closures aren't happening because communities don't need care, but because the financial reality of providing it in rural America keeps getting tougher. When a rural hospital closes, families face hours-long drives in emergency situations, expectant mothers lose access to obstetric care, seniors suffering a heart attack or stroke, they arrive too late. As we mark National Rural Health Day this week, we must renew and strengthen our commitment to rural hospitals by ensuring fair reimbursement, strengthening telehealth and infrastructure, and preserving access to critical resources like the 340B drug program, a key revenue stream for rural hospitals. Rural hospitals must not only survive but thrive in every American. We need to keep that because it's not about zip codes. Mr. Chairman, I yield back.
Mr. Speaker, rural Georgians and rural Americans are older, sicker, and less likely to have health insurance than those in our cities. In fact, compared to urban areas, rural Georgians are nearly 5 times more likely to die early from cancer. But access to care is collapsing. Over 20% of rural counties in Georgia have no doctor or only one doctor, and 200 counties across America have no doctor at all. When rural hospitals close, the community loses not only health care, but jobs, restaurants, banks, and hope. When Southwest Georgia Regional Hospital closed, the nearest ER became 40 miles away, a life or death distance. Rural health care is not just about hospitals and doctors. Clean drinking water, wastewater upgrades, and broadband are necessary for health and survival. Rural areas simply don't have the tax base to modernize these systems alone, so Congress must invest funding in rural development, energy, and health care to ensure they can thrive. Rural health is not partisan, so we must work together to make access to care a reality for rural Americans everywhere.
Mr. Speaker, I rise today in recognition of National Rural Health Day to honor the millions of Americans who rely on rural healthcare systems, and to shine a light on the unique challenges faced by our rural and territory communities. In places like Guam, distance is not measured in miles, but in oceans. When a family needs specialty care, when a child requires emergency service, and when one of our mononcles seeks follow-up treatment, the nearest option may be thousands of miles away. Hospitals and healthcare facilities across our nation, including Guam Memorial Hospital, bear tremendous responsibility with limited resources. And it is the doctors, the nurses, and allied health professionals of Guam who meet the responsibility every day. They provide life-saving care despite higher costs, workforce shortages, and outdated reimbursement formulas. Financial sustainability for these institutions is not just about healthcare, it's about equality, economic stability, and national security. That is why I'm working on policies to strengthen reimbursement, modernize federal support programs, and expand workforce pipelines so every community, no matter how remote, can count on its providers and hospitals for quality care. Thank you, Mr. Speaker.
Thank you, Mr. Speaker. In recognition of National Health Month, let me put some quotes out there from individuals that I represent. Just in Ohio, we know health insurance will become unaffordable for tens of thousands of people across our Northwest Ohio district, over 500,000 Ohioans and 15 million Americans. Please let me share some examples. A constituent from Clyde, Ohio said it clearly. High insurance prices will allow people to die by making health care unaffordable. It was terrible before the ACA. We need affordable health insurance. Another citizen from Eden in Williams County shared how their medications have become so costly that they now have to seek out patient assistance programs, and their prescription insurance has increased $119 a month, which is unmanageable on a fixed income. A Toledo resident told me, everything's going up. Groceries cost more, child care, rent, and unless Congress acts, health insurance premiums for us will double. Our family cannot make it. We don't have an extra $100 per month. Mr. Speaker, I hope you're listening to these pleas, because unless we address the cost of health insurance in this country, too many people are going to die. Thank you, and I yield back.
As the representative of a district full of forests, mountains, and rugged coastlines that are beautiful, but often mean a long drive to the hospital, I know that preserving rural healthcare access is literally life and death in our communities. Tribal health clinics, federally qualified health centers, rural hospitals, independent providers are facing challenge upon challenge upon challenge. At Grays Harbor Community Hospital, I saw firsthand how tariffs are driving up costs for medical devices and supplies, adding financial strain to already stretched rural facilities. The hospital recently invested in a new MRI machine, a critical upgrade that offers faster scans and higher resolution images, but because of tariffs, they had to pay significantly more money to purchase this machine, money they now can't use for other things. Advanced medical equipment like this is increasingly expensive under the Trump administration. Add to that Medicaid cuts and the big ugly bill, the end of the ACA tax credits, the strain and uncertainty is challenging. On National Rural Health Day, we should be working together to expand care, not making it more difficult for rural communities. I yield back.
Mr. Speaker, I rise today to highlight the growing mental health care crisis in rural America. Nearly 1 in 5 adults lives with a mental illness, yet rural communities lack the providers, facilities, and resources to meet their needs. In my own district, an entire county has just 1 child and adolescent psychiatrist. For families seeking timely, specialized care, that's not just an inconvenience. It's a barrier that can mean the difference between preventative help and a crisis. Communities across the country face the same impossible math: too many needs and too few providers. That's why I've introduced legislation to support clinicians who commit to practicing in rural areas and to expand telemental health services tailored to farmers, fishers, and foresters, the people who power our rural economies. Access to quality care should not depend on your zip code. I urge my colleagues to join me in ensuring rural Americans are no longer overlooked or underserved. Thank you, and I yield back.
Mr. Speaker, I rise today as Americans celebrate National Rural Health Day. According to the Virginia Department of Health, 88% of Virginia is rural, including much of Virginia's 9th District. As a result, communities face numerous barriers in the rural areas to receive adequate access and opportunities for health care. Our rural health care providers do our country and our health care system a tremendous service, tending to the health care needs of rural communities. I am committed to working to improve rural health care access in my time here in Congress. Today, let all of us honor the profound contributions of these health care providers. Thank you to the doctors, the nurses, advocates, and others who strive to make rural health care a possibility in America and to make America a truly healthy America in all regions. I yield back.
Thank you. Mr. Speaker, National Rural Health Day is a chance to honor the communities that keep this country moving. The farmers, the teachers, the kupuna, health workers, first responders, small business owners, and families who fuel our local economies and preserve our way of life. It's also a moment for Congress to recognize that rural communities face challenges that are different, not because they are less, but because they are often asked to survive systems that were not built for them. What some call in Washington innovation is really rural America being forced into a constant state of adaptation, forced to make do, to improvise, and stretch thin resources even thinner simply to maintain basic access to health care. Every day in Hawaii, I see mobile clinics reaching isolated communities, school-based health centers stepping up for low-income children, and community health workers bridging cultural and geographic divides. Rural communities everywhere are pioneering models of behavioral health integration and telemedicine, not from a place of creativity or convenience, but necessity and survival. We've proven we can adapt to impossible situations, but extraordinary flexibility cannot and must not replace true investment. Ingenuity cannot replace federal partnership, and resilience cannot continue to be a substitute for resources. We have unfinished business here before us in Congress, but what gives me hope is that we have allies and advocates on both sides of the aisle ready to lead. Across the country, from the volcano-lined communities in my district of Ka'u to the farming slopes of upcountry Maui to the taro patches that I see on Kauai, one truth is crystal clear. Rural America is tired of being resilient. When people call us resilient, what they're really saying is we've been forced to survive hardship. Resilience means we're struggling. Resilience means we're being asked to endure what no community should ever be asked to endure. Our people cannot survive on resiliency alone. Rural America is tired of being tired. Rural America is tired of jumping from one difficult situation to another. Rural America is tired of learning to bend without breaking due to a lack of resources, investment, and support. What rural America needs is an immediate, revolutionary, transformational investment, a historic top-to-bottom overhaul that rebuilds the healthcare system from the inside out. Rural America needs a profound change on a scale that we have not yet seen before. And most importantly, rural America, where we all live, needs a chance to be known as more than just resilient. It deserves a chance to thrive. We cannot rely on Band-Aids and small step forwards, short-term pilot projects, especially when we know families are driving hours or having to even get on a plane for care. Hospitals are closing, behavioral health crises are going untreated, and when the difference between life and death is the distance between one rural town and the nearest city, this is unacceptable. Our people will literally die without bold, immediate systemic action on rural health. Today, we still lack long-term stability for community health centers, for teaching health centers, and the National Health Service Corps. Critical workforce and training programs remain stuck in reauthorization limbo, and bipartisan bills to strengthen EMS capacity, expand telehealth, and improve behavioral health access still await action. We said these issues were urgent last year when we were on the floor. They are even more urgent today. Rural communities cannot afford another year of waiting. That's why we're pushing forward with real bipartisan solutions that simply cannot wait another Congress to be enacted into law. My Rural Health Clinic Modernization Package, including the Rural Behavioral Health Improvement Act, cuts red tape and strengthens reimbursements so rural clinics can stay open. The Health Act protects telehealth access, including audio-only visits for families who lack broadband or live hours away from their care. The Community Teams Act and Strengthening Pathways to Health Professions Act rebuild the rural workforce pipeline, supporting students and providers and keeping scholarships and loan repayment programs accessible and tax-free. And the Rural Health Care Technical Assistance Act gives rural facilities the tools they need to prevent closures and stay financially stable. These are practical, bipartisan solutions built for lasting impact, not another short-term fix to grab a headline. And that is why caucuses like ours, the Bipartisan Rural Health Caucus, and special order hours like the ones that you've seen tonight matter. They remind America and this Congress that despite everything going on in our politics, there is still a path forward. There is still work we can only accomplish together. In closing, I want to thank all of my colleagues who joined us tonight to give their speeches, and to the over 70 members, Republicans and Democrats, who make up our caucus. Your presence sends a clear message. Rural communities matter. To my constituents in Hawaii and rural Americans across this great country, your voices keep us grounded. And to every nurse, doctor, EMT, pharmacist, community health worker, small clinic team, you show us both the urgency and the solutions every single day. This work is not just policy. It's people, it's families, it's the future of rural America. So let's continue to listen, to act, and to deliver together, because when rural communities thrive, all of America thrives. Thank you, Mr. Speaker, and at this time, I yield back.